Hello, I'm Dr. Karim Kurji, York Region's Medical Officer of Health. Many jurisdictions where the variant has appeared have had explosive and exponential growth. Some of the experts in the US believe that the variant will become the dominant form of COVID-19 virus by the end of March. In York Region, we now have 39 confirmed cases of the variant. We've broken these down into different households, and there are 24 households. Out of these 24 households, 6 of them have had it introduced from abroad, which then means that the majority of the households have acquired it locally. We do know that the variant is present in virtually all age groups and at least 6 of the 9 municipalities in York Region. In other words, it's circulating amongst our residents, and it is probably here to grow. It is very necessary to have the restrictions at the borders that have been implemented both by the provincial and federal governments, as these would reduce the cases of COVID-19 coming into the country, and with them, cases of the variant. It is also very important that we continue with the stay-at-home order, which is in force at the moment. The variant, apparently, the virus tends to peak faster, it goes to higher peaks, and it lasts longer. So this translates into it having short incubation periods and being transmissible very fast. The province, through the public health labs, will be testing all specimens of COVID-19 beginning this week. So we expect to be finding more cases of the variant. However, the actions that the provincial and federal governments have been taking at the borders, both at the airports and hopefully at the land borders, will assist us in reducing the numbers of COVID-19 cases, and with them, a reduction in the numbers of variants coming into Ontario. In addition to that, we have established a COVID-19 variant unit that aggressively follows up on the cases and identifies the close contacts quickly and ensures that they are self-isolated appropriately. In addition, the Regional Municipality of York, in association with the province and many other partners, have established a voluntary isolation center where we are urging some of the new cases of the variants to go and self-isolate. The strategy then is to slow down the spread of the variant to a point when we could potentially be immunizing the whole of the population. Now, this is going to be difficult, as you can imagine. However, the good news is that the Moderna and the Pfizer vaccines seem to be effective against the variant. The other good piece of news is that of the 39 confirmed cases in York Region, only 10 are active at this point. The other good news is that our cases of COVID-19 are declining, and we are not experiencing a growth in the cases. Now, it is much too early as yet to say that the variant is not causing any issues in York Region, so time will tell. For this reason, it's important for us to follow the stay-at-home order. Please stay at home unless it is for essential visits, like to the pharmacies, to the healthcare provider, or for grocery shopping, or for essential work, and maybe exercise. Beyond that, it is important that we reduce any chances of transmission of the variant in particular. We are currently, with our community partners, providing the second dose of the Moderna vaccine to those in long-term care homes and retirement homes. Our community partners are accordingly doing the same thing with respect to the Pfizer vaccine. Because of the disruptions in the vaccine supply chains for both Pfizer and Moderna, we've had to pause our rollout somewhat. However, as soon as the vaccine supplies become available, we intend to move next into the high-risk congregate settings. The provincial plan of prioritization is available at our website at york.ca/COVID-19. Internally, we have formed a COVID-19 task force on vaccines, which have representation from several sectors, and they will guide us with respect to the prioritizations in accordance with the principles laid out by the province. Finally, I urge you again to follow the public health guidelines. They remain virtually the same: maintaining your physical distance of 2 meters or more, washing your hands frequently, having the right cough and sneeze etiquettes, ensuring you don't go out even if you've got mild symptoms, accessing testing at the assessment centers if you've got symptoms or you've been a close contact of a case. Together, we will be able to get out of this soon, but we need to remain vigilant. Stay safe and remain vigilant, and thank you.